COVID-19 has been around for a couple years now, and every day we continue to learn new things about this disease. I recently had a few patients who had COVID-19 infection but continue to suffer from shortness of breath, chest pain, body aches, fatigue, even months after recovering. Long COVID syndrome or post-acute COVID syndrome is defined as people suffering from lingering symptoms of COVID-19 after they recover from the acute infection. Usually this is defined as after 4 weeks of infection. And these symptoms seem to last months to over a year, but maybe even longer, as we're still learning about it. So what are the symptoms of long COVID syndrome? People usually have lingering fatigue, feeling shortness of breath, continue to cough. Many people have headaches. People describe a brain fog or forgetfulness sensation. Many people have persistent altered taste and smell. Some people have worsening muscle pain or new muscle pain that they never had before. Palpitations on minimal exertion, such as just standing up, is very common. Some people have constipation or the opposite, which is diarrhea. Sometimes people feel like they eat food, but the food just sits in their stomach and doesn't go down. As a result, they can have abdominal pain. Sometimes people get nauseous and vomiting. Hair loss is common as well, and it's a pretty significant amount of hair loss. Some people describe numbness and tingling in their hands and feet. Many people describe depression, either it's new or worsening from previous conditions, and mood swing, mood changes is pretty common as well. Overall, long COVID syndrome is a very debilitating disease. Study shows that 40 to 70% people who were previously hospitalized due to COVID-19 still have not returned back to work after 2 months after they discharge home. And those who have been able to go back to work, a quarter of these people need their hours and workload reduced. How common is long COVID syndrome? Some studies say 1 in 3 people. Sometimes I read 1 in 2 people who have had COVID symptoms. In the world, there has been over 230 million people who have recovered today from COVID-19 infection. In the United States alone, 38 million people have recovered. And the numbers just keep going. This means that millions of people in the United States alone and hundreds of millions in the world will likely suffer from long COVID syndrome. This will become a new form of chronic disease in this decade, maybe even longer. So what causes long COVID syndrome? The short answer is that we don't really know. Maybe there's a prolonged inflammatory response or immune response. Some scientists say that there is altered metabolism. The rate of your metabolism decreases or increases in certain aspects. Some say it's direct damage to the organs and cells and tissues in the human body. Maybe there's a neurological complication. The most convincing theory is that this is a neurological complication, or what's called autonomic dysfunction, which means there seems to be a disconnection between your brain and your body functions. What used to be done before the infection that were automatic, now there's a disconnection. So when your brain tells your body to speed up, it doesn't know how to catch up, and therefore most of the symptoms occur from that mechanism. So who gets long COVID syndrome? Several studies have shown that you can get long COVID syndrome even if you had only mild disease. In other words, you don't have to be very sick or hospitalized with COVID-19 to end up with this devastating disease. The most important question today is, what are the treatments for long COVID syndrome? And once again, we don't really know exactly how to treat this condition, precisely because we don't really know what causes this condition. In general, most of the studies I've read says that we need a multidisciplinary approach, which means that if you do have long COVID syndrome, you might need a whole team of people to help you cope. For example, if you have physical pain or disability, you might need physical therapy to help you cope with that. Primary care, I believe, is key in treating this condition. Will be the new front line of long COVID syndrome. So optimizing the treatment of your previous conditions such as hypertension, heart disease, working up your shortness of breath and chest pain, and helping you manage your pain and helping you cope. A really big component is mental health support. CBHA has access to counseling and therapy and medical management for mental health. So we encourage you to reach out to us if you do suffer from this condition or in general mental health issues. Social services is really important, and I think that we're going to start seeing more and more of this services. So for example, many people suffer from employment trouble, so they need support with that. Governmental agencies need to also start supporting long COVID symptom patients. There are many support groups, either online or in person, that you can reach out to as well. So my own experience with people who are suffering from long COVID syndrome is that I've seen quite a few of patients like that in my clinic, ranging from 20-year-olds to 70-year-old, 80-year-old patients. Quite often, this is very debilitating. Some people have come in for disability claim or disability paperwork, so I know firsthand that this is very devastating for family life and also work life. In general, the best way to prevent long COVID syndrome is to get vaccinated and make sure that we don't get the actual infection. Primary care, in my opinion, is going to be key to help people cope for this condition. So the better primary care doctors and providers learn about this condition, the better it is for our population. We would like to be there for our patients. We want to support our patients however we can. If you have any questions about COVID-19 or even the vaccine, please give us a call.